All right, all right. We're kicking this thing off, and a lot of times we want to kick it off to where we can literally set the stage. So, as I'm doing a health summit, I really got somebody that's a doctor, Dr. K. This is what I call him. Dr. K said that he would be a part of this summit and that he was going to educate us on some of the public health situations that's going on right under our noses. So you heard his bio as I gave him an intro. Dr. K, how are you, sir?
I'm good. How are you doing, brother? No.
Man, I'm doing well. I'm doing well. So I know you're gonna bring a whole different aspect to this thing. You're gonna bring awareness and education on why this summit is even needed. So talk to us about some of the information that you have and some of the things that you found.
Okay. I wanted to deal with social determinants of health. And what I wanted to do when we started talking about me possibly doing this, and first of all, let me say I'm not a medical doctor. I have a PhD. And I also am not a public health expert, but I have done conferences on it and done some studying about it. And so I just decided it would be good to share some information. Basically, health is a feeling of well-being that covers your physical aspect, your mental aspect, but something that we generally do not talk about or think about is that it also covers a social aspect. So health is something that each individual is concerned with, but at the same time, there are huge, significant social and cultural aspects of it. And basically, some of the things that I have been studying ask the question, is inequality making you sick? When we started talking about this thing, we were talking about COVID, and you mentioned why do Black and brown people get sicker than other people? And from that conversation, I decided to kind of go into some of the aspects that deal with this. So what I want to say is that besides medical concerns that deal with health, there are social and cultural aspects as well, and that these aspects are very, very significant. And for the past, I guess, 10 to 25 years or so, public health officials have been dealing with what they call social determinants of health. And so some of the social determinants of health are income, levels of education, the community that you live in, the fresh foods, because we have what are called food deserts. So depending upon your income and depending upon your education, you may not get access to fresh food. Also, information that you have, because many people deal with health based on what they are able to purchase and what they're able to do. And health, as important as it is, and health in time may be the two most important resources that we have. But as important as health is, we don't do a lot of study of it. We don't pay a lot of attention to it. And generally in America, in the US, if you don't have these things, you deal with health on an emergency basis because you don't go get regular checkups. You generally see the doctor in an emergency situation. You don't deal with medication that might help maintain a certain level of health. You generally deal with medication and prescriptions when you are forced to buy them. Now, the United States, because it's, go ahead, I'm sorry.
Oh, no, I was just saying, I'm listening to you. Go ahead.
Okay. The United States spends more money on health care than any other industrialized nation. by far. They
Mm.
spend more than twice as much, but the money is not well spent. So inside the United States, people with higher income, people with higher level of education, people that live in better communities, people that have access to insurance, they live longer, higher quality lives than people who don't. But across the world, the United States statistics are woeful when
Mm.
compared with other industrialized countries. I want to pull something out for you and just share some information with you. For all the rich countries for which there is data, the United States has the highest infant mortality rate in the world.
Mm.
The highest infant mortality rate in the world. It has the highest homicide rate, the highest teenage birth rate. So we more than likely teenagers are doing what teenagers do all over the world.
Right.
But here, our teenagers engaging in those activities, they become pregnant much more prevalently than teenagers do throughout the industrialized world. We have the highest child poverty rate. We have the highest child injury death rate. We have the greatest gap between high and low mortality rates within a country. We have the highest poverty rate. We have the most hours worked, except for New Zealand. And this is something that's going to wipe people out. We also have the smallest middle class.
Oh, wow.
Yeah, yeah. And all of those things impact health. So your health is individual, but it's also social.
Right.
And when I was doing some reading and studying to do this, one person said that your zip code has as much to do with determining your health as your genetic code.
Oh, wow. That's
Yeah.
big because, and here's the thing, and this is why I wanted to start with you, Dr. K, because a lot of times people are talking about health and wellness, fitness, whatever the case may be, and they're really just throwing just money at it, trying something new, and they're not really looking at the writing on the wall, so to speak, of who really gets the best health care, some of the things that we need to be conscious of as we move forward. And that's why we're doing this summit. The summit is really to open the eyes of people on what's out there that could benefit you and help you and truly help you, not like a gimmick, not like a fad, but something that can truly help you. And as you learn from all of these people that are true professionals in their field, you could take this, you could take that, and we're recording this as well. So, you know, if you get something from one person and you implement it as a habit and that gets you better, you can go back and listen to something else and implement that later. So, man, I really appreciate the information that you're giving to really set the tone of why we're doing this.
Okay, well, I'm very happy to participate. And another thing that I want you to consider that when we are talking about health and wellness,
Yes.
that is primarily a middle-age pursuit. Middle class pursuit. The people who are generally talking about health and wellness are not in situations where they're hand to mouth or wondering where the next meal is coming from. Health and wellness is something that is considered by people with more resources. So people with fewer resources who should really be looking at health and wellness, particularly for their children, are generally not talking about it. These are what they mean when they say social determinants of health.
Right.
There's a reason that there are more COVID-19 outbreaks in schools in neighborhoods of color than there are in other schools. More than likely, those schools are overcrowded. They're not able to social distance. They may have various disciplinary situations that they have to deal with. I remember one of the good things that happened as a result of this, as people becoming more aware, is that remember when you went to elementary school, you didn't want the free lunch because that may say something about how much money your parents did or did not make. And people didn't want to cop to the fact that my mom is too broke to buy me lunch or, to even send me lunch.
Or economically challenged, Dr. K. Economically challenged.
Yeah. But now they just give the food away to everybody. They are still providing meals. People can go to the schools and pick up meals. They have boxes, so it's not an everyday thing, but they have boxes with fruit and bread and canned goods and things like that for everybody. And it's not a class-based thing where you have to maybe feel ashamed that you're taking advantage of this, even though you need it.
Got you. So, one of the things that you and I we agree on a lot of different things, some of the things that we've done together and some of the things that we've worked on, but you have something that you've gotten that has gotten you some great results. And man, I'd love for you to start telling people about it. What you got, Dr. K?
Okay. Well, one of the things that I wanted to do, and I told you at the beginning, we want to talk about individual responsibility as far as health is concerned, but we also just want people to know that it may be more than individual consideration. I am a distributor of and a user of Somaderm homeopathic transdermal gel. Now, one of the things was, and this is an individual supplement that someone can deal with just like you deal with multivitamins. What the gel is so magical about the gel is that it is connected to the pituitary gland. The pituitary gland is a gland that helps people grow from children to adults. It helps your head get bigger as you get older. It helps your shoulders get broader as you get older. It helps things in your body grow both internally and externally. It kicks in the processes. This is what the pituitary gland does. But the thing about the pituitary gland is that around the age of 25 or so, it stopped. It's not as prevalent in our growth. And this is called human growth hormone. So it ain't no code you have to figure out. It tells you what it is right in the day. And so the human growth hormone, this gel, is something that helps the pituitary gland begin functioning again. So that you can continue to receive the benefits of all of the energy, hair growth, all of the things that happen as a result of your pituitary gland and the way it works as you are an infant before you even know you have one till you get to be 25 or 26. So the gel does several things. And I want to talk about two things that it's really helped me with. I'm a cancer survivor. And during the time that I was doing chemo and radiation, I developed neuropathy. Neuropathy is a nerve disease, and you can have it primarily in your hands or your feet and your throat. When I was going through treatment, I had it in all three places. I was blessed to be able to outgrow it in my throat, and I can't even tell you how big a difference that makes because drinking everything. It numbs. First of all, I'm blessed because mine doesn't hurt. It's kind of numbing, but it's not anything that goes away. It's just something you learn to live with. But when I stopped the treatment, it left my throat and it left my hand, but it's remained in my feet. And I was basically told that, this was something that I'm going to have to live with. The gel has of neuropathy in my feet. So this was kind of amazing to me because nerves are one of the hardest things to repair.
Right.
And
right.
Yeah, so that means that this goes in there. The numbness is gone. I can just do more things with my feet. There's a level of stiffness that's no longer there. And another thing, man, I'm not gonna pimp you out, but I have a little bald spot right here, which many do, and the gel is actually getting that hair to grow again. And it's baby hair now. And, I didn't know it. I was rubbing my head and I feel a little hair back there. So that's so that's another thing. That's two of the things that it's really impacted with me. But I mean, it helps with your libido. It helps thyroid issues. And so many people nowadays have thyroid issues. It's an overall wellness piece that's good for your body, and that you can continue to utilize this gland that's so important even after it normally shuts down.
Dr. K, anything you want to say before you go?
Real quick, man. In studying this, one of the most important pieces in the social determinants of health discussion is information. So the fact that this is available, the fact that it's available for free, the fact that anyone who wants to tune in and get this information is very, very important. And so one of the things is that, as I was studying and doing my research, they kept repeating, share this information, come together, talk. You may want to go to your congressperson and other people to let them know there are people in their district that have these concerns. So information is like right at the top of the things you should do to deal with some of the implications of these social determinants of health.
All right. Well, Dr. K is part of Justice League. Thank you for being a part of the team, man. We really trying to do some things and make a difference, not just for ourselves, not just for the team, but for the whole community. I appreciate you for tuning in.
Absolutely.
Hey, we're going to come back with another speaker right after this. See you in a moment.
Peace.